Let's look at the patient's position and microscope, which are some of the most fundamental things you need to pay attention to before cataract surgery. First, regarding the patient's head, tilt the head slightly in the direction of the surgeon's seat with the patient lying down. This allows the irrigation solution to flow down without pulling during surgery. Lift the patient's chin slightly so that the patient's eyes are level. Doing so deepens the chamber, helping to operate safely. Due to Bell's phenomenon, the pupil moves upward when only one eye is opened. Therefore, open both eyes of the patient so that the pupil does not move upward. By allowing the patient to only look at the microscope light, the pupil can be centered, making the surgery safe. It is very important to have a good view when performing surgery. Therefore, it is necessary to adjust the microscope. Center the patient's eyes in the center of the microscope screen. Focus the microscope. Make sure all the microscope lights are turned on. In our case of microscope, it must always be checked that all 3 lights are on. Adjust the brightness that you can see the best. You can begin surgery when you think you're ready.